just gonna pull up my slideshow. Um,
And there you go.
Alrighty. All right. So thank you so much. Yeah, I'm really excited to be here today to talk about photobiomodulation. This is something that I've become really passionate about over the past couple of years. I think there's so much to this science and so much promise for the future. So I get really excited about opportunities when I can just kind of provide some education around this. So just to go over some points, I'll just be defining photobiomodulation, providing some examples of how it's used, the mechanisms of action that we do understand or think we do, applications of transcranial photobiomodulation, which is what I specialize in, and just some considerations if you are looking to either use photobiomodulation for yourself or integrate it into a clinic. So first, what is light therapy? So phototherapy, or can also sometimes be low-level laser therapy or low-level light therapy, refers to the use of specific frequencies of light to support health and wellness. So this is looking at all different forms of light and what ways they interact with our biology. Photobiomodulation, on the other hand, typically refers specifically to red or near infrared light, whereas phototherapy, again, is that full range where we're looking even into UV and blue light. So just to clarify where this differentiation comes into play with sane photobiomodulation. So just looking at the popularity over the past 10 years of people searching specifically for photobiomodulation, you can see that especially since 2021, there's been a pretty significant uptick of it. And even this is a pretty specific word. So just looking for light therapy in general, we're seeing the same kinds of trends. So obviously this is starting to kind of gain a lot more popularity with the general population. So what are some of the things to consider when just looking at light in general? We can think about even our room lighting. So part of some of the issues that we've seen that come into modern day is that we have more issues with energy, issues with kind of this brain fog and cognition. And a lot of it is from moving indoors now. We're not getting quite the same amount of energy that we got from the sun before. So we see people moving inside, we're just kind of limiting in that exposure. And so now we're getting a lot more of these feelings of apathy and fatigue, focus, and more. We also know, on the other hand, too much blue light exposure can disrupt sleep. So I put this little image in the corner of a person sitting in their bed, scrolling on their phone. This is that direct blue light that we're getting, which signals to the brain it's time to wake up. This is daytime for us now, which you definitely don't need at night. And then the interesting point that I just wanted to include in here is that there's also a small research study that was looking at the impact fluorescent lights or these very blue heavy lights had on prisoners and their mental health. And it came back showing that, yes, indeed, there was an impact from having this, from the sleep dysregulation and mood dysregulation that resulted from it. So different hues of light can impact our mood, our energy levels, and ability to concentrate. So it's something to think about when we have lighting in a room about what kind of mood you're trying to facilitate. For instance, if we're in the daytime, particularly in the morning, you want to have exposure to more of this blue light. This is what can stimulate us to be able to get done with our daily task. However, in the evening, we don't really want that exposure because of its ability to disrupt our sleep. Another thing to consider is forest bathing. We've known that green light seems to be the easiest for the human eye to be able to process. So forest bathing can be a very calming thing for people. So even thinking about natural light around us. And then the two other lights that come with this are migraine lights, which are green lights, specifically used for migraines. So they require somebody to kind of be in a dark room, turn off all of their lights, and then you can use this migraine light that's green. People get really good relief from this. And also the SAD lights for the seasonal affective disorder, people using more of those full spectrum lights, especially in the darker months, to be able to boost some of that energy and cognitive energy. And there's other uses for this as well, such as visual light stimulation. So here's just a device that's down on the bottom. This one is looking at properties of entrainment to support cognition. So these are looking towards, both healthy individuals and cognitively impaired individuals to use entrainment principles. Essentially, we're pulsing at a specific rate to induce specific neurological changes. So this device has been around for quite some time, and it can be used to help support focus, sleep, energy, etc. On the other side, we do have that it's kind of operates by inducing a hypnagogic state. So while this can be used for supporting sleep, focus, or energy, can also be used as an alternative to some of the psychedelic therapies. Not everybody is a great candidate for doing psychedelics, or they just don't have the proper support system with them. So having an alternative that's a natural thing, like just using flashing light to be able to induce some of the same properties you get with hallucinogens can be a safer alternative, especially then as soon as the light stops, people can just get in their car and drive home. But then there's a lot of clinical applications of photobiomodulation. So this is a massively long list that I'm definitely not going to go through all of these. And this is also not exhaustive. These are just some of the common things where photobiomodulation is used. And also, just to clarify, this actually does include some blue lights in it as well. It's not just red and infrared. But some of the main categories of where a lot of this research is going on, big one is in dentistry, interestingly enough. So here you can see somebody getting, a placement cured. So this is something that probably a lot of us have experienced going into the dentist, but it's also being used for things like having, issues of tissue regeneration. It's also looking at infections or surgeries that people have and difficulties of healing afterwards. Light can be used in those situations. Other ones are for eye-related issues. So this is really kind of an emerging field. At this point, dry eye disease seems to be sort of the main focus. But I think there's a lot of promise for glaucoma, and I think we'll hopefully be seeing more of this and possibly other eye diseases as well. And we also see it for injury recovery. So people using this, for mild aches and pains that they have, or just, overuse, things like that. So this is an example on the side of one of these flexible pads. So you can see that it could be wrapped around for the knee, it could be used for the shoulder, but you could even be wrapping it around your leg or an arm or something else. So these flexible pads can be really helpful for injury recovery. There is, though, on the other side in the clinical model, people using lasers, and they're more of those handheld pointers. These are much higher power, so they're typically operated by clinicians specifically, but they can be used in clinical settings as well to be helpful for injury recovery. And then gut health. This is obviously not an anatomically correct picture here on the side, but I thought it was really important to mention this. This is also an emerging field of research that's been coming up with photobiomodulation. And what we're seeing is that there's some type of influence on gut health. It's really not super understood outside of we understand that there's a decrease in inflammation. There seems to be some rebalancing going on if we look into specific biomarkers, but ultimately we don't know exactly. I just think it's an important thing to be able to mention in this, especially when we're seeing the role of it in neurodegenerative diseases. Having something that can help with gut health earlier on might be helpful for these outcomes later into these diagnoses. And then there's some general wellness. You might have seen these light masks that people have that's to help with either wrinkles or acne. There's these red light hats that are there to help with hair growth. In the corner, I don't think that was actually an infrared sauna, but since infrared light can't be pictured, it's a lot easier just to get a regular sauna. But infrared saunas are popping up a lot more now too, because we're seeing more of these benefits from it. So just to point out why all these different places are starting to implement this, why it's becoming more of even a home use device, is that the safety involved with all of it. Photobiomodulation is considered well tolerated by most individuals, so it's considered a wellness device. especially when we're looking at LEDs versus lasers. LEDs have a significantly lower heating factor compared to the lasers, so that risk is even more mitigated. And studies have even been conducted with children as early as 5 years old. And honestly, there's probably even younger at this point, too. And to point out, even newborns have experienced light therapy, being exposed to UV blue light if they have jaundice as a child. So, how does this actually work? So looking at light and in particular from the sun, we see 10% of it is about that UV light, 40% is visible light, but 50% of it is infrared light. So this is where us moving indoors, not getting as much of that exposure, this is a significant amount of the sun's light. That's infrared light that we're missing out. So the reason that we look at infrared light in particular is for its penetration. So here on the side, I do have a couple of examples looking from that blue, and really actually that's from the UV, into blue, green, and then red near infrared light. And you can see as they start getting from that blue UV side of it over to that red and near infrared light, you have much greater levels of penetration. So when you're thinking about what you're trying to use the light for, it's important to consider that when you're thinking about what kind of wavelengths will be necessary for that. But there's more than that than just the wavelength. The other things to consider are tissue composition. If, for instance, we're looking to apply light to the head, it's a lot different than if we're applying light to the stomach. You have to get through hair and skull and meninges just to make it to the brain tissue. Versus on our stomach, we don't have a hard shell on the outside that we have to get through just to make it to the stomach. So thinking about that tissue composition is really important. The coherence of the light is another important consideration. While LEDs have a lot less heat factor that's involved with it, they also have less coherence. So you might have to have longer treatment periods versus a laser, which has high coherence. You might not need quite as long of treatment periods. Pulsing of the light can be an important factor too. It seems to be a lot less so when we're looking at the body. Typically, most of these devices just kind of have a constant wave or 10 hertz pulse rate. But when you're looking into the brain, there's a lot more variety that we're starting to see. And again, research is really just kind of emerging on this, but there's much more options that we're seeing. The irradiance is really important to consider because this is part of where we run into issues with a lot of these devices that are on the market, is that their irradiance is actually so minuscule that there's no possible therapeutic properties of it. So having an understanding of this is really important. A lot of companies don't necessarily provide this outright, but being able to figure it out is a good thing to do. The beam size is also important, so just thinking about how much area that you're needing to cover, and the beam size will determine that as well. The angle of penetration, so part of it is there's these great panels that are out there. Those are fantastic, but it's not going to be as great, for instance, for trying to target the brain because it's just a flat panel. You might want something that's going to be curving a little bit more. Or like in that other slide that I showed where the person had a wrap around their knee. It's something where you needed it to be more form-fitting for the knee. It wouldn't work as well to just have a panel. The distance from the body is really important. People think if they're just like a couple of inches and fully clothed from the light that they're going to get benefits. That's not true. Really, once you start moving about an inch away, you're losing a significant amount of the light. So it's really important to be as close to it as possible. And also clothing will definitely block any of the light as well. And that last one is just looking at the dosage for it, which I'll get into a little bit later into this as well, but that's just giving you the formula for it. So what happens when the light is interacting with the body? Well, one of the things that we do see is that there is an activation of these TRP, the transient receptor potential channels. In particular, we do see a modulation of TRPV1. With this, we are seeing that it potentially could be part of what's helping photobiomodulation to decrease pain sensations in individuals, but there might be other mechanisms going on with this as well. The next and most commonly talked about mechanism of action is through the mitochondrial activation. In particular, we look at the chromophore cytochrome C oxidase, and this absorbs photons that are in that red and near infrared light range. Cytochrome C oxidase is one of the precursors that helps to produce ATP. So once you have a greater activation of this, and we have a greater production of ATP, and ATP is a primary cellular energy molecule. It's able to travel through the body, and then it can end up knocking out nitric oxide that's blocking cells from receiving oxygen, and therefore it can provide more nutrient delivery to the cells, as well as increasing blood flow. On the other side of this, we have a reduction of oxidative stress. So while we're having that knocking out from this nitric oxide so that we're getting greater blood flow, there's also an interaction with reactive oxygen species. So this is the other side of stressing the cells so that we start to signal the body to have these recovery processes activated for themselves. So we're kind of building strength like you would if you were doing weight training, for instance. So we interact, we kind of increase this ROS presence that signals the body that it needs to be coming into action. And then that's how we get some of these benefits from just the light interacting. So what does this end up resulting in? Obviously, those things on their own are just important, but some of the outcomes, especially looking transcranially, we see that there's a neuroprotective factor. So this interaction that we see with the ROS, where once we have this increase in it, the body is getting stimulated to have its own processes activated. This helps the cells to have greater resiliency against future injury. So again, it's like that working out. If you're building up a little more muscle, you're going to be less likely to be injured from a light hit. The other thing that it does is that it has an upregulation of the brain-derived neurotrophic factor. So this is a crucial protein supporting the survival of existing neurons, but it also encourages the growth and differentiation of new neurons in synapses. So especially once somebody's had an injury of some sort, this can be a really helpful and important thing for their recovery. Some additional mechanisms that I just thought should be pointed out, even though they're maybe not as well understood. Also, neither of these images on this side are in any way accurate, so please don't take them and try to use them in any other way. So there is an upregulation of anti-inflammatory cytokines. In particular, one of them is an interleukin-10. So this can be really helpful for the body to decrease inflammation. There's support for the integrity of the blood-brain barrier. So we're seeing more so that, the blood-brain barrier is essentially able to do its job more effectively. And we're seeing support for lymphatic drainage. This is still really new in the research, and I know somewhat controversial, but it does seem that especially using infrared light at night, in particular, if people can while they're sleeping, we're seeing an improvement in lymphatic drainage, which is especially helpful for some of these neurodegenerative diseases. So the overall benefits from all of this, we're seeing an increase in the cellular respiration, therefore more ATP is being produced. And we see a reduction in inflammation, especially important in neural inflammation, and an improvement in blood flow. So how does the light actually work? Because all of these things sound great, so wouldn't you just want to do more and more and more of them? Well, unfortunately, that's definitely not how it works. Since we're looking at that idea of stressing the body just enough so that its own processes are activated, we don't want to stress it too much. Again, we can go back to that gym sort of metaphor here. If I went into the gym and tried to lift a 100-pound dumbbell, I would definitely get injured. I'd like to think that I'm really strong, but I'm not that strong. It's just going to be too much for me. In fact, I wouldn't be able to lift it. Let's just be honest. So you want to find this sweet spot where you're pushing your body enough, but we're not pushing it over the edge. So we're looking at kind of that optimal dose. For a lot of people, that tends to be typically once or twice a day of using some device. And again, that time can end up varying. There's quite a few pieces of literature that are out there that kind of give this very specific time, that you're supposed to do it. It varies depending on the device. So this optimal dose depends on what the actual device is doing. So let's look at some of the applications when we're looking at transcranial photobiomodulation. So some examples are stroke. So there's quite a bit of research that's gone into stroke. It's still something that has very small amounts of participants ultimately. So a lot of the research is new, but there are some promising results that are coming out. In one particular one, they were looking at aphasia after stroke. Individuals in this study just did 18 sessions and showed significant improvement compared to the control. Again, it was only 6 individuals, and they were in particular chronic stroke patients, but nonetheless, it's something promising. We also see an improvement in promoting neurogenesis after stroke. So this was 7 days in a row that the rats in this particular case were having infrared light applied to their brain. And then they looked at what the responses were. So we saw a promoting of cellular proliferation and a decreasing of pro-inflammatory cytokines. I'm sorry, pro-inflammatory microglials. We also have long COVID. So in long COVID, this was looking in particular at individuals who were reporting sustained issues with brain fog, just kind of cognitive energy overall. So all of these people had been diagnosed with COVID and had since technically recovered, but still had these lasting issues. This particular study looked at individuals who were just using a helmet with infrared light versus individuals who are using the full body photobiomodulation. And both of them had significant improvements compared to the control group that did not receive either of these. Another area that's been coming up more so is depression. There's actually some studies that are also looking at some of the anxiety, but depression seems to be a bigger focus right now. And we're seeing that with these studies, again, we're still having small populations, but they're reporting improvements in symptom severity. So there's also looking at injury recovery. So we have TBIs, and in particular CTE, which typically is only diagnosed, once somebody has died. But I think there's increased recognition now that this is something that does appear earlier in life and perhaps could possibly even be mitigated. So they did a study with 61 former athletes who had repeated head injuries, which is something that can be a, solid indication potentially for CTE. And they showed that either after 8 or 10 weeks of using transcranial photobiomodulation, they were showing significant improvements on cognitive testing. So even though these were athletes who had head injuries years beforehand,
قصدك مش عاجبك يعني؟ ها؟ ندوب سوريا ما لقيتش.
Go ahead, Jordans.
Okay, sorry. So even though these athletes had injuries long time ago, years prior, they were still showing that they were having improvements in their cognitive testing. So it's a really hopeful thing to look at for even people who had brain injuries that aren't recent and they still have issues from them. They also showed in another study that using photobiomodulation helped to prevent apoptosis. It supported repair of axonal damage in the nerve fibers and promoted homeostasis in cells impacted by excitotoxicity. And then we also have post-concussion. So maybe the ones who aren't quite as extreme as TBI or repeated head injuries, but still struggling. There's millions of people who are diagnosed with concussions. It is quite a common thing. And we see that with people using photobiomodulation, they were reporting improved cognitive efficiency, improved sleep quality, and decreased pain intensity. In particular, for these, it was looking at a headache. But yeah, seeing these recovery for people who are kind of just left out and, to heal and see what happens. Another study showed that just using photobiomodulation for 3 days, the day of the injury and then the following days, there were reduced markers of apoptosis, and there was some functional recovery exhibited in terms of behaviors. So here's a case study that came up looking at TBI. So this is Gray Maynard. He was a UFC fighter and naturally had a history of head injuries due to his career. So some of the things that he was presenting at the time were main issues were with attention and focus, but he also had some issues with sleep and some obsessive thinking, impulsivity, compulsive behaviors. So we started using transcranial photobiomodulation, and these two maps were taken 3 months apart. In this, just to point out, looking at solely these maps, you can see that there is an improvement in the overall power in both the delta and the theta bands, which is pretty significant from those just to be 3 months apart. The other thing is, though, he started reporting that he was able to sit down and read for 10 minutes and remember what he read, which was one of his metrics he set out beforehand. Additionally, he was opening a new business and he was able to sit down and work at the computer, which is something he hadn't been able to do previously. Another area of focus and research has been with autism. So this is looked at both children and adults alike. In particular, for this first study, this was with children, but they showed that after 8 sessions of photobiomodulation, the children were exhibiting reduced irritability and other behavioral symptoms. In another study, they were showing that there is a reduction in the CARS scores, reduction in behavioral and cognitive rigidity, and improved attentional faculties and sleep quality. And what's interesting is also in that same study, they pointed out that there was reduced caregiver stress and the caregivers were reporting increased compliance and behavior. And if anybody has worked with this population, you know that that makes a very big difference if you can get some compliance and if the caregiver is not miserably stressed. So this is a case study of a child with autism. Call him CCK. He was 5, I believe, at the time of this one. He had limited verbal ability and seemed to show little understanding of daily conversations. Low verbal and cognitive performance in various situations. He mixes up surnames of his teachers, delays before speaking. So this provider decided to start including transcranial photobiomodulation based on the idea that autism is associated with mitochondrial dysfunctions. Transcranial photobiomodulation supports mitochondrial functioning. It seems like an obvious choice. And he was also using neurofeedback at the same time. So what he saw from doing this is that originally CCK hadn't been making a lot of improvements while using just neurofeedback alone. But once he started integrating with the transcranial photobiomodulation, they saw improved social interaction and language abilities. He was able to name his teachers already just from doing the neurofeedback. But once he incorporated the transcranial photobiomodulation, he was now greeting his teachers and greeting them in an appropriate time. He was talking about his emotions and he was able to properly express what he wanted, for instance, to say that he was thirsty. And this is, I think, one of the most remarkable parts. So they did a pre and post request of him to draw a dinosaur. So there was some verbal guidance that was provided by the teacher for each of these. And again, these are about 2 or 3 months apart. On the left-hand side, you can see this was before they incorporated the transcranial photobiomodulation, and on the right side was after they had started incorporating it. It's pretty significant shifts from, being very unclear of what it is to a much more clear representation of what was being asked. But there's obviously other areas that we would definitely look at applying transcranial photobiomodulation. Alzheimer's is certainly one of those. With Alzheimer's, where you do see there's that neuroinflammation that comes around with the beta amyloid proteins and tau tangles. Obviously, there's memory impairment. We're seeing disrupted functional connectivity that's going along with that, and ultimately neuronal death as we see this uptick of pro-inflammatory elements. So how does photobiomodulation help? Well, it's activating that cytochrome C oxidase, which increases that ATP production. So we're improving more blood flow. We're reducing that oxidative stress. This reduces free radical production and inhibits amyloid protein precursor activation. So helping to really support the cells, making sure they're operating as they're supposed to, but also increasing that blood flow so that we can be clearing out any of this toxins as well. And so some of the case studies that have been conducted, there was one case study with 18 subjects with mild cognitive impairment. So they were diagnosed with this. They underwent a single session of transcranial photobiomodulation. They were testing the visual memory span test, and those who had the single session performed better after treatment and showed reduced hemodynamic response. Essentially, they were being more cognitively efficient in the way that they were approaching this task. In another study that was conducted, there was 57 individuals with mild to moderate dementia. They were using a transcranial photobiomodulation device across 8 weeks. And the active group showed improved cognitive functioning. They showed improved sleep. But also their caregivers, again, were noting improved mood, decreased anxiety, and a positive impact on daily routine. And just to point out that this was actually an at-home device. So even working with the population with dementia, they're still able to operate with at-home devices because the light therapy is intended to be something that should be easy to use, just like walking outside and getting in the sunshine can be, depending on where you live. But what if you don't have a diagnosis like one of these? There's no injury, there's no Alzheimer's, there's no autism, just sleep in general. So things that we see with sleep issues is when sleep deprivation increases amyloid beta levels in the cerebrospinal fluid. We see that sleep efficiency and slow wave activity during non-REM sleep are decreased in individuals diagnosed with Alzheimer's. Short or long sleep duration and changes in sleep patterns have been linked to poor cognitive performance and risk of dementia. Increased concentrations of interleukin-1, pro-inflammatory cytokine, was seen in saliva of students with poor quality sleep, and poor quality sleep was associated with lower brain volume. So just having poor quality sleep alone has so many awful health impacts on us, and it's something that's so easily overlooked. People are quick to just go ahead and give up sleep so they can be able to finish this project or do whatever their thing is. And ultimately, we're just causing health issues from this. So how can photobiomodulation help with sleep? One is it can inhibit amyloid protein precursor activation. It improves cognitive performance for people for that next day. Can downregulate the interleukin-1 beta and upregulate anti-inflammatory cytokines such as interleukin-10. And it may help increase gray matter in the brain, although studies are still inconclusive. So some of the studies that have been conducted, there were 58 subjects with subjective cognitive decline. So these individuals were not diagnosed, they just noted this in themselves. And they were using transcranial photobiomodulation for 6 days in a row, just once a day for 6 days. For the first couple of days, everything was exactly the same in both the treatment and in the control group. But by the fifth day of the treatment, sleep efficiency and REM sleep had improved and was significant and sustained. Another study that was conducted were 15 subjects with general anxiety disorder. So, not in particular that they were looking specifically for sleep, but this was a reported issue from the individuals who were participating in this study. So, this was across 8 weeks. And they again show that there are significant improvements in the sleep quality as measured by the testing. So, what are other ways that we can look at possible changes that occur? Well, I know I showed this in my pre and post results earlier for Gray Maynard's case study. But one thing that people are really interested in right now in this field has been looking at the changes that can happen to the EEG. So you'll look across studies, and one of the kind of common things that comes up is that people sort of show time and again that the power of alpha bends and beta bends are increased after using transcranial photobiomodulation. It doesn't matter what the nanometers is for the light or what their time was or any other aspects of it. No matter what, we're seeing increases in these two particular bends. And what I think is really interesting about this is that we see those increases even if somebody just puts light on the palm of their hand. So it's obviously something that's coming about that's a much larger physiological process than we truly understand. But time and again, you'll see that this is something that's reported from these studies looking at changes to the EEG. On top of this, they showed that they do see the greatest changes being where the light is. So for many of these transcranial photobiomodulation studies, they were using handheld devices and they focused it on either the left or the right forehead. This is mostly because it's an easy area to access. There's not a lot of hair to get in the way, so you're pretty standardized across your individuals. So what they showed is when they did EEG scans on these individuals who were participating in this, they did see that the greatest impacts on the alpha and beta frequency bends were under where the light was shining. However, throughout the entire head, even if they were shining it directly on the forehead, you're still seeing changes at the very back of the head. So from this, we could see that there's both a direct impact that using photobiomodulation has, but there's also a downstream effect that occurs too. And there is also noted impacts on functional connectivity. So we've seen throughout many studies that, again, whether they put the light maybe just right on the front of the head or at multiple sites on the head, whenever that we see an impact on functional connectivity. Sometimes this is activating a single network, but the majority of the time it's activating multiple. So part of this is with that direct and indirect effect that light has on the brain. Even if we're shining the light just on the left forehead, you're still activating more of these networks underneath so that you're getting really the whole brain to be involved in this process. So one of the examples for this functional connectivity was looking at task of individuals working with working memory task. For this, they were looking at healthy individuals in particular, and they were testing them using transcranial photobiomodulation. What they showed after using the photobiomodulation was that there was increased functional connectivity in the prefrontal cortex. So, in that executive functioning network in particular, to be able to really focus on the task that they were looking at. And again, that decreased oxygenation, exhibiting more of that cognitive efficiency. So we saw that on that other example, with a mild cognitive impairment in the visual span testing, there was that decreased oxygenation as well exhibited there. The same for this working memory task. One of the things that we have been seeing observationally and that there's definitely not as much research about, but I'm very hopeful that there will be maybe within the next year or so, is that there's an increase in the peak alpha power. This is really important to note because essentially everybody has a peak alpha power. And as long as you're a healthy individual and an adult, it tends to be between 9 and 11 hertz. This kind of just sets the tone for how you go about your day. And between 9 and 11 hertz seems to be a comfortable rhythm for us to process what we're taking in throughout our days and manage it well. Once you start dipping below that 9 hertz and we're looking more into 8 hertz or even 7 hertz as that background frequency, then you're thinking more about cognitive impairment. In the 8 hertz range, it might not be very significant or necessarily noticed by other people, but especially dipping down into that 7 hertz range, it's a pretty significant level of impairment. Generally, for many years, this was thought that really once it kind of declines, you're just sort of out of luck at that point. So people are kind of just at management states. But what we've been seeing from people who are using the transcranial photobiomodulation is that this peak alpha power is actually increasing in its speed. So for individuals who have already been diagnosed potentially with like mild cognitive impairment, they're showing a little bit slower speed, let's say 8.3 hertz. We're seeing this starting to increase, creeping back closer to that 9 or that healthy range. So something that's a really interesting phenomenon that's not really necessarily expected, but definitely interesting to consider. And with that, there's additional things to think about considering looking at photobiomodulation. So one, and this is one that I just have to harp on constantly, is hydration. Most people are dehydrated anyway, especially if you're looking at some of these memory issues or other functional issues. People just might not be, capable of really taking care of this on their own. And even if people are, they're still bad at it. So, infrared light does interact with the water in the body, although the exact way that it does is unclear, but we do know that there's an interaction. So, having people drink water before they're using any kind of photobiomodulation can really help to improve those benefits, but also mitigate any unwanted side effects. So essentially, if the body's already compromised by dehydration, there's a higher chance that the light can end up further dehydrating somebody, and they might have responses such as a headache or fatigue, kind of the general things that you expect when you're looking at dehydration. And obviously, drinking water can just help to mitigate these issues. It's a good thing for people to do anyway, so just trying to push them to do it at any point if you're using photobiomodulation is a good thing to do. And dosing, I brought this up earlier on the slide that I was talking about that formula to be able to calculate it. The reason that I can't say here is the exact dose that's perfect for this condition is for this slide itself. You can see that even though there's the same areas that are being targeted, there's totally different dosages that were implemented. So there's really no clear consensus on it. This is where looking at kind of the specs of the device and thinking about how strong it really is without irradiance can be a good guide for some of this dosing, as well as LEDs versus lasers. As I mentioned, those lasers are going to tend to be much shorter periods of time that you're using it. So dosing is kind of a pain to figure out, but in general, you kind of get to a place where you can sort of feel out your particular device and how it works for most people. The other thing thinking about is that wavelength. And that wavelength is important for what you're trying to achieve. So if the issue that you work with or focus on is more superficial, then visual wavelengths are probably better suited. So again, this is where you have those like face mask and things for beauty care. Those are all going to be in the visible light range typically, or maybe some of them get into the infrared, but in general, they're in that visible light. If the tissue or the issue is deeper in the body, then longer wavelengths, so getting more into that near infrared light range, might be better suited than visible. The other thing to think about is the design of the device. So again, I mentioned this earlier, but it's worth repeating that you really do need to consider about the angle of the light. So just because you're sitting in front of it or near it and you can see the light, it doesn't mean that the light's actually shining where you're trying to target. So just thinking about what you're trying to target in this, you want to get something that's really fitting for that cause. And just to consider, panels might be best if you're looking for large surface areas, kind of general health and well-being, good crowd pleasers. Another thing to consider is that pulsation. So there is still significantly unknown information about this, and people are constantly working on it. So there is quite a bit of research to support the 40 hertz can help with working memory in both healthy and memory impaired individuals. It does seem to be helpful for kind of brain brightening in general. So it can be helpful for cognitive energy and support. This can be helpful for both older and younger individuals too. There doesn't seem to be some particular age limit on it. And I just put this image down here on the bottom just to be clear when we're talking about this 40 hertz pulse rate. This is what I mean is that it's pulsing 40 times in a second, just to clarify with that. And this is something that was mentioned earlier about that 40 hertz has the mechanism to direct the microglia specifically to areas with amyloid beta to remove these without creating a toxic storm in the brain. Some research has shown that 10 hertz seems to have a stronger biological impact than constant light does, and that it can penetrate more deeply than constant light. So, where this comes in of trying to look now between 40 hertz versus 10 hertz, we do see that 40 hertz is helpful for memory, but 10 hertz is also having a strong impact. So it gets a little bit more complicated about what exactly is right for what exact condition. Most of the research is on constant light, just from the way that the research has been conducted. So it is kind of easy to fall back on that if people are ever, looking for what protocol might be best for them. It can pretty much find constant light for most of them, and that shows that there's great benefits. There's just a potential that pulsed light could have a stronger effect, but we just haven't had enough research conducted yet. I've heard before that somebody was using 1024 pulsed hertz for meditation. I've never seen anything to back that up, but I thought it was interesting. And I do have providers reporting that they've been using 14 hertz pulse rate for long COVID and sort of dysregulated nervous systems, those people who are very 100 miles an hour or zero. That 14 hertz seems to be helpful for balancing. Again, there's not any research that's been conducted around this in particular that I know of, but there are quite a few providers who've been using this. And who knows what else will come up? There's, at least initial research on some other pulse rates, but again, the population size is too small and there's not been replicated studies as of yet. So we really don't know what else could come out, but there's probably a lot more frequencies than just 40 and 10 and constant light. So looking forward to seeing what will come out. So for contraindications, they are rare, but they're important to know. Cancer is going to be one of them, especially if there's active cancer. If somebody has a history of cancer, then you probably want to still take precaution depending on how long ago that was. But especially if there's active cancer, you really want to take caution because there is a chance that photobiomodulation can promote angiogenesis, but then this potentially could feed the tumor. So avoiding it for cancer. A metal implanted in the head. So for individuals with shrapnel or if they have deep brain stimulation, these individuals are not going to be good candidates in particular for transcranial photobiomodulation. I realized I should have put this in here, but obviously this would also be the same for the body. As far as I know, titanium is the only metal that is the exception. So, like we've worked with people who have titanium skulls, and that is an acceptable metal to have in the head. But otherwise, there's a chance for heating, so we wouldn't recommend it. In hyperthyroid conditions, there's really not enough testing for this. It's really just kind of based on theory, but you'll see this on many different photobiomodulation companies' websites that they recommend this just to take extra precaution. And then implanted stimulation devices. So obviously I mentioned the deep brain stimulation, and that's, if you're using transcranial photobiomodulation, but just the implanted stimulation devices in general, it might not be a great idea, at least to be using pulsed light. It might not have any interference, but since these implanted stimulation devices are already trying to create a particular rhythm, and not disrupting that is for the safest. Epilepsy, that's definitely a question that I get frequently when looking at transcranial photobiomodulation. People are really concerned about it. There's lights and flashing. There's no evidence that constant or pulsed light that's being used on the head, that is in no way geared towards the eyes, should trigger any seizure activity. And in fact, they've been showing some emerging research has shown therapeutic benefit of using photobiomodulation with seizures, first in reducing the frequency overall of seizures, and second for providing a protective factor for neuronal cells. So individuals are having fewer seizures, and when they are having them, there's less damage that's occurring. So epilepsy is definitely not a contraindication at all, but it's a very common thing to get if you start working with light. So some of the future directions that I'm really excited about and looking forward to, one is combining it with other technologies. Well, I think photobiomodulation can do incredible wonders for a wide variety of things. It does work best if it's going to be working with other things at the same time. So two that I think would be interesting are TMS and ultrasound. I think it's being combined right now with radio frequency, if I'm not mistaken, to look at the impact on cancer cells. So I think that would be a really interesting one as well. I also think it'd be really cool to see with IV. There's intracatheter light that's being experimented with, as far as I know. This was mostly in Russia, I believe. But it's basically a more direct way to be able to reach the blood vessels. So I'll be really curious what happens with this. It seems like it could be helpful potentially for delivering different medications in a more efficient way, but I'm sure there's other things with that as well. And then as a pain relief alternative, certainly, in the United States in particular, then we have a huge opioid epidemic. Then the issue is of, being in the pain cycle, that kind of keeps you locked into these drugs. So having something that potentially could be disrupting that pain cycle, first you can have it, on the actual site of injury if there is issues with inflammation so that you can get some mobility back, but also just having the actual neurological aspect of pain disrupted can be really life-changing for these individuals. But also for people who just experience chronic pain. It's a pretty common thing nowadays as well, especially having more sedentary lifestyles. A lot of people experience chronic pain. And again, you can kind of easily tip over into, becoming an opioid user if you don't get some type of relief at some point in time. So I think it'll be really great the more research that goes into that. And there's definitely some research that's coming out now, but I think there'll be a lot more moving forward. So that was everything that I had planned. And I really appreciate this time, and I would be happy to answer any questions. I also have more slides. I look like other people maybe had longer talks, but I wanted to give some opportunity for any thoughts that you all have.
All right, Jordan, I think we have some questions. That was actually great. This is from the chat. Let me just pull up some questions for you. It's a long, okay. The study of 8 to 10 weeks. What was the dose, time, and how frequent was the light applied? I don't know if you remember that part. It's a little, I
Yeah.
think that was back in, hmm, this was in the early part. I mean, does that ring a bell? Or,
Mhm. Yeah, let me just
Yeah,
sort
yeah,
of.
yeah. She almost is done. I just want to lay down and to take my phone from my car. There's nothing.
okay, there you go. We got her.
Um, they were using a 40 hertz pulse rate. Think they're 20 minutes because I think that this is just a standard device. But I do not know the specs for this particular device.
Okay. Um, just to share you my ignorance here. So before I started understanding photobiomodulation therapy, so when I see red lights, I thought that was like, hey, this is what I need to see. But as I went through my study on this, it actually is so the deeper nanometers, as you said, as far as you go in the thousands, you're not going to be seeing red lights anymore. So for the people out there who's ignorant like I am, I was always looking, I need red lights. This is not working because I don't see red lights, but the red light now, as I found out, is a bit more superficial than what I thought, that it only works on the surface. And as you get into the 600s, 800s, now this is where the definition, familiar definition to always hear about near infrared, mid infrared, and even far infrared. So is that correct? Correct me if I'm understanding this wrong.
Yeah, yeah, exactly. So really once you get into kind of the like mid 700s, around 750-ish is when it starts becoming invisible or mostly invisible to the human eye.
Right. So for people out there, don't look for the red light and thinking that if that's the one that's effective, the one that really does not have a color, that's the one that you really want to get into those infrared, near or mid infrared states. And also, as you mentioned, that this is not all about the highest nanometers you get, the more benefit that you would get. This is really staying in the middle. Majority of the studies that I've seen, especially for transcranial and Alzheimer's, most of these are in the 800s and 1000s nanometers. So if you go farther than that, meaning around 3000 would be far infrared, it's a more systemic therapy. It means it's not even related to stimulation of cytochrome C. When you go into the 3000s for far infrared, it's really more of now really warming up the body through water molecules. And it's not talking about ATP mitochondria stimulation anymore. I don't know if that makes sense to anybody there, but this is really fascinating when I was understanding this. Just because now even the machines that I get or use, I actually had to study this from the get-go. So, but anyway, okay, let's go back to enough about me. Let's talk about your questions here. I'm just backtracking here real quick. Okay, what about photobiomodulation with Hashimoto's? Do you have any experience about that in your readings?
No, but I mean, I would think that there would be benefit for it. I mean, ideally, right, this is being supportive for the whole system. I think that there was a good possibility for it, but there's not any studies, at least that I know of as of yet.
All right. Dr. Bill, you want to jump in?
Sure. What about photobiomodulation devices for blood irradiation versus topical? Are they similar or better results or expected as systemic? And what is your knowledge about this?
Um, is this more about like the like ozone for
And
the
I think it's the IV. There's a brand, I can't
Yeah,
mention it, but it's, I think, if correct me if I'm wrong, the one who asked the
yeah.
question.
There's an IV. Yeah, you irradiate the
Yeah,
blood and then you ozonate it also. Yeah.
yeah. So it's in Europe. There's a lot of this in Europe. So I think that's what they're trying to ask you.
Yeah, I think that it would be, I mean, super helpful. I think that it kind of feels silly that we're not doing stuff like this. Again, it's just using light. Like, how hard would that be to just add into, whatever else you're doing, like these ozone therapies?
Right. I think just to vouch for that question, there are studies for this, especially for the brand. If she's pertaining to the specific brand that starts with a W, it has actually been seen to be effective with myofascial pain, musculoskeletal disorders, and even I've seen MS. I think they tried on this, but these are pilot studies. RCTs, it's not that prominent yet to give this a little bit more of a kick in terms of proof, but it is effective. So in a sense that in terms of clinical experience.
Okay. I have on the last question, Hashimoto's thyroiditis. I found there's emerging evidence. There was a 2013 study in lasers and surgery and medicine. 43 patients, 830 nanometer laser, 10 sessions over 5 weeks. 47% of the patients had reduced or discontinued levothyroxine during a 9-month follow-up, improved thyroid echogenicity, and decreased TPO antibodies levels. Then there's another one for immune modulation and reduction of oxidative stress and thyroid autoimmunity in 2021 in the photobiomodulation. And then EBM was found to aid reducing TPO levels and improve thyroid volume and function. So there's some evidence here. Common wavelength was 830 nanometers, 2 to 3 times a week for 5 weeks. Okay. So
Did you say 100 nanometers? What did you say?
830 nanometers.
Oh, okay. So that's basically near infrared.
Hmm.
Mhm.
Yeah.
Okay. In ASD, I'm talking about autism spectrum. I'm assuming with self-harm with very limited verbalization, with TPM help with self-harm.
Yeah, so that's kind of what these studies were showing is these reduced, behavioral outbursts. So whether it was, the self-harm or, just having these behaviors that were maybe externally harmful. Yeah, they showed a significant reduction in it. There seems to be a huge help and support for that emotion regulation and just general processing. So I think it helps to reduce these behaviors.
Do you have contacts in the Santa Monica area? Where do you practice?
I don't practice. I'm a remote worker doing consultations, but
If I could get in touch with you, I have a patient that I'd like to see if we could get therapy for.
yeah, yeah, absolutely.
Um, not in the chat, but the question. So, what's the difference between what you're doing and transcranial magnetic stimulation? I know I realize it's a different technique, but have you done any information? Any have any information on that?
Yeah, so one, certainly people can have a lot stronger reactions to TMS than they do to photobiomodulation in general. Just because it is a lot stronger of a sensation, it's a lot more disruptive. They also seem to have some properties that work together quite well, which is why I think it's interesting to think, and hopefully there will be at least a couple studies that are done this year combining the two of them. But yeah, it's interesting because they really do seem to work together well with both like increasing cortical excitability and decreasing cortical excitability in the only two studies I found that combine the two. So yeah, there's definitely some overlaps in it, but they're pretty different just in terms of, TMS is just a lot more intensive of a intervention.
Okay. Okay. Um, is PBM appropriate for small vessel brain disease?
Yeah, so it definitely seems, I mean, obviously any of the literature is, supportive of it, although there's not really great research that's necessarily around it. Having this increase in that, vasodilation, we can have greater blood flow. There's definitely some good benefits. It is interesting though, I will say, in just like my personal experience, I've noticed that sometimes people with small vessel issues um, can be more sensitive. So it's kind of an interesting, which is fine. I mean, you can work around it, like it doesn't matter, but it was just unexpected, I guess, to have this particular population be more sensitive.
Stefan says he had a young patient with detected by not which is some sort of scan. I don't think it's spelled that right. Trinuvo scan. I don't know what that is. I think it's from COVID or COVID vaccine, and he's
It's a
contemplating
full
using.
body MRI, the Prenuvo.
I see. I'm old. I don't know. What do I know? Hyperbaric oxygen, Arteriosil, and Vasconex. Um, that was a sort of an aside. Can we
Yeah,
use
yeah,
photobiomodulation for? You want to say something?
no, yeah, that's correct. Prenuva is a full body MRI and it detected small vessel ischemic disease in the brain in a very young woman. But yeah, that's a good question. Can photobiomodulation like do anything for this?
I mean, I don't think it would be any harm for it. Ideally, it should be promoting greater blood flow ultimately, especially if it's a younger person. I think you have a lot more opportunity for healing. So I think it's, a good thing to be using. There's not anything that seems like a contraindication.
Okay. Can we use photobiomodulation for dry eye syndrome, autoimmune condition? Man,
So
yeah,
this
go
is
ahead.
definitely not my area of expertise overall in this at all. I mean, from what I've seen, it doesn't seem to matter about what the cause of the dry eyes was. I think I've seen it both from being caused from autoimmune issues or from other things. So I don't think that that's necessarily a factor. But in terms of the rest of the question and about eye drops or any of that stuff, that's definitely outside of my scope of knowledge.
Okay. The question is anybody in the Miami area doing this?
Doing transcranial
I guess,
photobiomodulation?
yeah. Hmm.
Yes, although off the top of my head, I don't know. But
Okay.
yes.
Again, Stefan has TB 500 eye drops for dry eye syndrome. Uh, okay, I got a source for that. So, okay. How is peak alpha power measured via EEG?
So peak alpha is measured with your eyes closed in general. And typically it's taken from a particular posterior site. Some providers choose one and kind of always go with it. When I was doing neurofeedback, sort of stuck with like PZ, which is sort of in the back in the middle of your head. But you could take it technically from PZ 01 or 02, which are sort of a little bit lower, more in the occipital range. Yeah, and you're just looking for kind of the strongest frequency in that technically 8 to 12 bin range to find that peak alpha.
Do you have any books that you recommend, or any like training manuals or anything, some such thing?
For the transcranial photobiomodulation or for
Yeah. Hmm.
EEG? Yeah, so there's definitely a master class that's offered through our company, but
Okay,
yeah, really, if
don't mention that yet. Okay.
anything, if you look up Michael Hamblin, which is not related to me, and I feel like I have to disappoint people with that all the time. My last name doesn't have the B in it. But Hamlin, he's kind of like the father of like light therapy. He's got a lot of different like talks and videos and stuff that provides really great comprehensive education. Plus, he has an adorable accent, and that's always fun.
What about for glaucoma?
That I don't know. Again, I've been doing research that I think seems really promising, but I haven't seen anything yet that's definitive.
What about cleaning?
I published article with Dr. Michael Hamlin.
Oh, yay.
So he's a great guy. And yes, he is one of the top elite for, he's a PhD. He worked in Harvard and then he moved to, I think, back to UK or Ireland.
Yeah, somewhere over there. Yeah. He's done
Right.
incredible work.
Right.
Question about cleaning the devices when they're placed on the skin. Are there wipes that prevent contamination?
Yeah, that's a really great point. So for sure, I mean, it would definitely depend on kind of what level. Obviously, when I was doing it, when I was working with neurofeedback, I'm just working with people who don't have like open wounds or anything. If you were working with, open wounds and we're talking more about like blue light and things like that, obviously you need, something really heavy duty. But for things that are just like, transcranial photobiomodulation, a lot of them are, either little like nodules or a helmet, or it's just a couple lights or whatever it is. For those, what I was doing was just using alcohol wipes. And then I also had a UV light. So I cleaned my light with another light.
Hmm. What about use for pain for post herpetic neuralgia, shingles?
I would think so. I would think it would help with any of that. And good gosh, that pain is awful that I feel like it's worthwhile to
Well,
try.
you need to add methylene blue for infection. You can get better results. So patients either takes a methylene blue orally, depending on the shingles. It's just or it's so methylene blue. It's called photodynamic therapy. So it's another mechanism of action of activating photosensitizers. But methylene blue is very safe, especially for gingivitis and halitosis and um, teeth caries and all that stuff, whitening the skin, the teeth. Sorry, methylene blue for the dynamic therapy with red light it's an answer.
Okay, good. I'm specifically skipping the questions about where to get them and what brands and whatnot. We'll get to that when the CME portion is over. Okay. So anybody who's asked those questions, we will get to them. What about neuropathy?
I also think for neuropathy, there'll be some really great promise. Again, it's another area that I don't really understand why it hasn't been as explored. But yeah, I had like one of my friends even built her own little light device to use for her feet. So I think it's a great addition for, an adjunct to other modalities.
Great. Okay. Dr. Nario, do you have any email
Yes,
questions?
we have some questions. Jordan, by the way, please share your email if you want to our audience here. So your email is in demand, as you can see. So yeah, one of the things that you did mention about the benefits of photo, I guess, photo biomodulation would be the advancements in mild cognitive impairment. So this is a big problem that's happening a lot. And you did emphasize about the increasing BDNF that actually gets produced with that. But the curiosity here is, as you can see, the advancement is ongoing. Are you seeing PBM basically getting into the AI world, or is it going to be synced with wearable tracking now? I mean, as you had a slide there that in the future there's something that you're kind of discussing about it. Are these things, have you encountered this advancement before?
For sure, absolutely. So there's definitely already companies out there that are trying to implement an AI type model. I think a challenge with that, of course, is just, research is still so preliminary. I mean, especially in human models, we have a lot in rat models or mouse models, but we're missing a lot in the human models. So thinking AI, true direction for it is going to be a long way off in my mind. But in terms of tracking it with other wearables, I think that, for sure there'll be, great things looking at, like even with the Aura Ring and tracking your sleep. I think looking at heart rate variability. There's, some studies that have been conducted with that and showing the, kind of interplay that each of them have on each other. I think that'll be something really great. I think we'll get a lot more of these kind of multimodal systems. So ones that are incorporating, the pulsation of light, but also binaural beats that have like some type of overlapping, frequencies in their waveforms. So I think that's, another road that will be explored in the near future.
Right, right.
Let me
Sounds
add
like
something here before. I think the best option to monitor the efficacy of photobiomodulation is endothelial function test, pseudomotor, and autonomic nervous system, because that's the over effect of the light therapy as it increases the nitric oxide and buffer the redox. That this will lead to balancing the autonomic nervous system. That can be measured. There's a system for that, and also endothelial function. So something you may consider to monitor the efficacy of your treatment.
so. As you mentioned about the portability, I think that's part of that projected future of this. And now, I don't know if I'm sure you've encountered this before, that there are reliable home, I guess, home or for public consumption or public use products. Are there anything that, I mean, later on you could probably mention names, but are those reliable products that are out there? I'm sure there are medical uses, there are public uses for it. And yeah, what are your comments on the ones that you can get just online?
For sure. There's definitely like really, really credible home use devices. Absolutely. But this is definitely where you want to be super discerning. So in general, if you're on those websites that are, I mean, even Amazon, right? Like that just kind of have a lot of generic things. A lot of those products aren't providing the wavelength that they say that they are, and they're not providing the power output. So again, you're just kind of getting a flimsy pad that just lights up if you plug it in, So really looking into kind of what standards that these companies are doing for their testing. Like I mentioned, a lot of times you'll look and you can't even find the specs for different devices. So really trying to see, does this company actually tell you what these specs are? Are they telling you how they got them? Like just those sorts of things, you can find really, really high quality products.
So you mean the one that I bought from Amazon doesn't work? No, I'm kidding. So, I'm gonna send it back then. Another
I
question.
got mine from Timu. It
Perfect.
was $1.98.
See, that's a reliable. Hey, we're CME, right? We can.
Yeah.
All right. Another one. And any studies that compared PBM to like pharmaceuticals for anxiety or depression or combined PBM with these pharmaceuticals in terms of treating these conditions?
Yeah, so there's definitely ones that are looking at combining them, and we're seeing improved results, with the combination of the two for quite a few things, including, depression and anxiety for sure. I think there's some early studies that are looking at like ADHD and comparing to stimulant use versus the photobiomodulation. Um, yeah, and then there's definitely studies that are sort of looking at how can the photobiomodulation be supportive for delivering these drugs, things that we're trying to get across the blood-brain barrier. So yeah, there's a lot of different kind of studies and avenues with it. I think essentially what it comes down to is we don't really see photobiomodulation interfering with other types of medications. The biggest thing that I've seen or come across are just ones that can cause increased light sensitivity. Somebody might feel like the infrared light it feels hotter than most other people would. But that's really about it from what I've seen for any interactions.
Right. I have seen some studies in relation to PBM complementing or enhancing SSRIs. I think it's more specific for treatment-resistant depression. And as we know, as you mentioned a while ago, PBM reduces the neuroinflammation, which can also definitely affect mood disorders in a good way. You got all my questions out, Jordan. Thank you so much. I think everybody's wanting to hear more
Yep.
about your stuff.
Okay.
So
Okay. Okay. Well, thank you so much. And we'll see you again next week, same time, same station, 5 p.m. Pacific, 8 p.m. Eastern. And we'll talk to you then. Okay. Thank you so much, Jordan.